Hi, I'm Dr. Sneha Bhagwat, and today I'm here to talk to you about vaccination. As we all know that as of 1st of May 2021 onwards, the age group of as lower as 18 has been allowed to go ahead and take vaccination. So there are certain doubts that are being raised, and especially by the lactating mothers. Now I'm going to read out these doubts which have come to me, and I'll try to answer them. Some of the doubts are like, do young people also have side effects, and whether they are more in comparison to the older generation? How long does this immunity of vaccination last? Then the next question is whether we should stop non-vegetarian food and alcohol during and post vaccination. Also, how far is this immunity will last, considering that there are so many variants that are coming up? Should we go ahead or should we wait for some more time? So these are some of the queries. Now, the first query is about the side effects. Mostly the side effects that are reported are in 1/3 of the whole public who have been vaccinated, and most of the side effects are very mild, like we can say them not even side effects, they are just symptoms like mild fever, body ache, and sometimes pain in the arm where you have been vaccinated. So for this, what you have to do is just go ahead and take the medicines which are given to you at the vaccination booth. Along with that, definitely it is important that you lie down, take rest for 2 to 3 days, and also see to it that you are well hydrated, so have plenty of fluids. The second query is about the lasting of immunity. The immunity is actually nowadays it's every day a learning process, and every day there are some new studies coming up. But the good news is that until now, or the vaccine which has been given is extremely effective and have been preventing people from getting into severe condition, from hospitalization. Also, the mortality rate is seen to be lower who have been vaccinated. Also, we must remember that as many people get vaccinated, we build up the immunity against the virus. So in short, we contribute towards reducing the chances of even more mutations or more variants. So definitely we have to go ahead and take this vaccine. Now, as far as non-vegetarian food and alcohol is concerned, I think non-vegetarian and alcohol gives in general also a low level inflammation in the body, and due to this there is a induced low level inflammation. So we should be avoiding, like on the day of vaccination and next 2 3 days, as we are giving our body enough time to get this vaccine induced, because it's a biological response from the body. So just give some time for the body to get to normal, so that it's better you avoid non-vegetarian, especially the red meat, and alcohol during next 2 to 3 days. Now, as far as lactating mothers is concerned, it is necessary to know that all the lactating mothers can immediately breastfeed their children even after vaccination. Even though if you have some mild symptoms like body ache or mild fever, you please go ahead and do breastfeeding. Along with that, I would advise, as an Ayurvedic physician, in Sutika Paricharya, we have a very good diet and lifestyle. In case if a mother suffers from small trauma, there are some dietary changes which are advised and which help the mother to recover better without any problems. And this diet is like, you should go on a light diet. You should have soups which are protein rich, like moong soup, kulit soup. Also in Goa we have a very good recipe. It is we call it as methia chipes. It is prepared from rice, fenugreek seeds, and coconut milk with jaggery is boiled together, and this is a very lovely recipe to overcome any kind of trauma or pain, and especially during lactation. I think this is important that we have this methiazepaz at least once or twice a day if we have any such health issues. Apart from this, today, as on 2nd June 2021, Government of Goa has uh, uh, given a notification, and I think it is a very ideal move, because priority is given to all the vulnerable section of the society who is ranging from 18 to 44. So initially the vaccination will be given to disabled people who are physically challenged, and this will start from 3rd June to 7th of June. Along with that, lactating mothers will be also given priority who are postpartum 45 days. It is mentioned specifically. I'm sharing this notification here. So postpartum 45 days is post delivery after you complete 45 days. That means when your child is 1.5 months old, you can go ahead and take your first jab. The third priority group is parents who have children who are of the age of 2 and less. Then comes the people who are having comorbidities within the age group of 18 to 44. Comorbidities means people who are suffering from diabetes, hypertension, heart problems, cancers, cerebral palsy, renal failures. All these people are also allowed to take vaccination from 7 to 15th of June. And then comes the auto rickshaw drivers who are in continuous public contact, like auto rickshaw drivers, motorcycle pilots. And then last is the seafarers, and after this group is completed, then the vaccination will be open to normal public who are in the age group of 18 to 44. So when we are going for this vaccination for a better, hassle-free and smooth vaccination process, there are some documents that you need to carry. For example, the disability group have to carry the disability certificate, or the UDIT card it is called. The mothers and the parents have to carry their child's birth certificate. The seafarers have to carry a certificate from captain of ports or their identity identity card. Then the rickshaw drivers have to carry their taxi rickshaw drivers have to carry their permit of driving, or the taxi permit or the rickshaw permit, which is valid. Along with all these documents, of course, you need to also carry your own identity card, like the ID proof, like Aadhaar card or your election card. And the people who are in comorbid conditions, they have to carry a certificate mentioning the comorbidities from their treating physician. So these are some of the documents which you need to carry. So I think we all should go ahead and make this vaccination drive a successful one. As I said earlier, with this we are actually contributing towards reducing the chances of more mutations and more variants, and this minor side effects we can definitely overcome within 2 or 3 days. So my dear friends, please do share this video so that more and more public is benefited with this information, and there are not all the doubts which are there I have tried them to clear. So this kind of clarity will help the public to come forward and go ahead and take the vaccines. So thank you so much, and I hope to see you soon. Bye-bye.